Hello YouTube, this is Latoya. This is like take 53. I've been like trying to get a daggone video done like about 13 tries now. For some reason this phone does not record good quality videos as my old phone. And this is a Galaxy Note 3. So, I don't know. But I'm going to do my best, and I apologize if you can't see me properly, if my head looks 80 times long, or if I look like a bobblehead, or the sound is poor. I'm sorry. I'm still in my 13th month since having the RNY gastric bypass. I have some new subscribers. I'm going to say hello to you guys. Thanks for joining me. Numbers, my heaviest weight was 432 pounds. At the time of surgery, 347 pounds. Currently, well no, last week I was weighing in anywhere from 265. At the most it was like 267. But I weighed today, and it wasn't my normal scale, and that damn joker said 276, which I find that hard to believe because, one, I could tell the difference in my body. Two, on Sunday, I actually got into a full size 18W shorts. Normally I was wearing, see what I'm saying, YouTube? My phone just cut off right in the middle of that last take. Sorry. But what I was saying was that normally I've been wearing a 1820 or 20 because my butt is so big and my thighs are so big that I sometimes can't pull up the waist size that I need to be in. But I got in these shorts. They're 18W straight up, and a lot of you that's on my Facebook, you saw the pictures. So, and then I'll put them on here at the end too. I actually got into the 18W shorts, and the waist fits good, even though they were snug around my, my butt area and stuff. I got a lot of butt. I got a lot of thighs. But anyway, that's why I say I don't see that happening, because I wouldn't be able to get into them if that was the case. I just got into them Sunday, and today is Wednesday. So, yeah, and I know I haven't been eating too crazy, so the only thing I can really relate it to is I take hydrochlorothiazide because I have heart condition, so maybe it's fluid from that, and then next week, the end of next week will be almost the monthly time, so it could be that as well. Anyway, I'm just gonna stop focusing on numbers, just kind of focus on, I need to exercise more. I have been back in the gym, don't get me wrong, but I could do way better. Once again, we're still in overtime at my job, so that's kind of wearing me out. Other than that, still increased my shakes, still increased my water intake. Almost completely off of bread now, which is good. Only thing I still struggle with, is beverage choices. Not as bad, but sometimes I slip up and sip coffee when I'm very cold, which I've tried to wean myself off. I talked about that in my last video, which I've done pretty good, but I did get like a small sip because I was so cold. One day I did take a sip out of my husband's soda, diet soda, but there are none in the house, there are none near me, so I'm okay. Other than that, I've been watching a lot of the Neos out here. We got a lot of newbies in the community. We got Eve, we've got Shayla, we've got Lord have mercy, I just lost this child's name. I have to go back and look, but I try to keep up with some of the newbies out here, and on Facebook as well. And also I tend to share the bad side of the weight loss surgery. I was sitting here thinking earlier that, not here, but when I was at work, thinking about how when I went into this, I thought I was going to be so successful. Excuse me guys, my screen keeps dimming. Thinking that I was going to be so successful that I was going to drop 130 pounds in my first year. Thinking I was going to be this little toothpick person by now. And I think I just had this fantasy that I was going to be one of the ones who were considered successful. And things just completely did not turn out like I expected. I didn't expect to be one of those who only lost 80 pounds in their year. And I didn't expect to be the one to have the extreme relationship issues. I didn't expect to be one who would still struggle with eating in accordance with the program. I didn't think that I would still struggle with being the emotional eater or stress eater. I just thought things were just going to go smooth, you know. Honestly, now that I look back, I do think that I thought this tool would have more control over my decisions and things than I thought. But honestly, we have more control, and we have to exercise that control. As hard as it may be, I think that maybe if I were one of those who got sick frequently and a lot of more stuff made them sick, I probably would have been more successful. But at the same time, I look back where I was a size 34, 36. And here I am now in some 18s and in 20s, you know. And to go from a size 30, 32 to a 28, 18 in 1 year, that is something to be proud of. No, I didn't get to lose my 100 pounds or my 130 pounds, but I still need to be thankful for how far along I have come, even though it's hard. But I guess the Lord had a reason for me. So I guess you guys figured out that my video stopped again. Sorry. But I was saying that I think God, intended for me to go through this because we see so many successes and smooth sailings and things going on out here that there need to be more negative sides out here. I saw 2 people talk about the negative side effects of surgery besides myself, which was, well, actually 3. One lady was named Shantae. I talked about her way back in some videos. Takesha Positive Anderson, she talked about it on Facebook, how she saw some videos where people were talking about some things. And Koya dropping the pounds, she was talking about it on her video. Now in her case, she was, and I encourage you guys to look at her video. She was talking about relationships, and you guys know, boy, do I talk about the relationship aspect of the surgery. So for in her case, it was a friend who she was experiencing some difficulties with. In my case, it was my marriage. I honestly have to say that I cannot think of any instances where my friends or family members have been non-supportive or insensitive or ugly as far as my weight loss surgery goes. I have not seen any negative in my face. I don't know if something's, you know, said behind my back or anything like that, but as far as my observation and my treatment, I cannot say that I've experienced any negative side effects from surgery from family and friends. Then some people say some stuff like comments about what they thought about me when I was bigger. And some, I tell them, no, you're wrong. I've never been one not to have any self-esteem. I mean, hell, I've always had high self-esteem. There may be some times where I was just insecure about some things, but shit, my self-esteem was always on point. Even when I was 432 pounds, I felt like I was a damn diva. But, sorry guys, I got this defected damn doorbell and it plays Auld Lang Syne just out the blue. I don't know if I got a ghost in the house or what. So, I'm sorry if you can hear that. I'll try to talk a little bit louder. But anyway, I haven't really had any bad experiences as far as friends, family, physicians, whatever, co-workers. No. Everybody's been very supportive. They've been very observant, as you guys probably know who've had surgery. People notice everything. The only issues I had, like I said, was with my husband. Somehow he convinced himself that he's always been supportive and always had my back with this surgery, but I had to remind him that he's had me on some of these videos crying where he wasn't supportive, and we actually argued the night before I went under the knife. So I had to correct him on that. It was just that I was so determined to do what I needed to do for my health and for my life that I didn't care what he thought or what he felt. And he didn't like hearing that, but I told him, I told my surgeon, I don't care what the hell you think about it, if you support me or not. Latoya was going to have her surgery. And she did. But now, he is happy that I had the surgery. He thinks I am the sexiest thing. Not that he didn't love me then, because he reiterates that. He clears that up, clarifies that for me. Not that I didn't love you then, Toya. You always had a beautiful face to me, and this. But now he thinks I am just the sexiest thing that walks the earth. And I appreciate that. I do. I just hate that it took this long. And it took us being separated for a while for him to realize that he loves his wife, he appreciates his wife, and, you know, it was rough. That was a rough period. And we still struggle, don't get me wrong, nothing's perfect. As I have lost, his insecurities has like quadrupled. I mean, it's just bad. It's, you know, he's paranoid of where I am, who am I with, you know, who's calling, who's texting, you know, what time did I get home? Because he's lost me before, and now he's noticing that men are looking at his wife. When, you know, when we go out on date night, you know, they're looking, they're paying attention. He gets ragged on at work about his good looking wife with the big butt, you know, and it affects him. But like I tell him, I come to you. You know, I come home to you, and I'm married to you. So anyway, my goal is to not go to that dark place I went to before when we had our problems. And so far I've been doing very good with that. And honestly, my husband has conformed to the eating still. You know, he's not argumentative about it. And I do have to get on his ass. Uh-oh, sorry guys. His butt about drinking up my damn darn Premier protein shakes. He tends to want to make a meal, and what I mean is not just drink one shake. He wants to drink 2, 3, or 4 shakes in one setting, or drink 2 one setting, go back and get 2 more an hour later. So I have been having to jump his butt about drinking drinking too many protein shakes in one setting. But other than that, you know, it's still a fight, still a struggle, but I admire the fight in him. He's trying. But those are just some of my thoughts on surgery from my aspect. You know, like I said, I thought I was going to be more successful. I do get jealous when I see people who had their surgeries a month or 2 before me, or a month or 2 or 6 months after me, and they've already lost 100 and something pounds, and they're already, you know, skinny and stuff. And here I am, just the little engine that could, just putting along. And but at least I'm not where I was. That I can be thankful for. If I can just get past this damn stall, I'll be so happy if I could just see 245 for once, you know. I do want to talk about skin. Even though I don't have the sloppy skin, I have it. I recently incurred a belly button infection because my skin is so bad. And actually I'm sitting here now just in a long shirt, but I'll try to show you how my skin is just hanging here, okay? It's just like everywhere, just flat. And these are like my thighs. I got on underwear, everybody, but it's just my skin is so much that it's bad. I had got a belly button infection last week because it's been so hot, and I was wearing tights and stuff when I was working out, the stretchy stuff, and my belly button is so deep. So I've learned, so if you guys are going through this, even if you aren't having an infection, I've been told by a nurse, and it worked, you can get some of the bacteria infection spray that you put on deep cuts and wounds and sores. Spray Q-tips, clean down in there, because even though I was using a washcloth and stuff, but still it just wasn't getting everything all the way up in there because your fingers are so, so use a Q-tip, spray some of the bacteria stuff. If you are too afraid to dry using a Q-tip, use a hair blow dryer on a cold setting and dry your belly button. And if you itch, she said just get some of the over-the-counter yeast infection cream, and because that's what it is, yeast growing in your belly button. Put that on, and then I use the cornstarch powder in my folds, my skin folds, because they itch, because they sweat. It's hot. And make sure your doctor document all this stuff, especially if you want to try to get your insurance to cover it. You want to document all your rashes, all your infections, things that you're trying to keep the itching down, and the skin lesions and things like that. So just a little note there. I know some policies don't cover it because they consider it cosmetic, but when you're having skin breakdowns, infections, rashes, and stuff like that, baby, that's medical. And our skin is only going to get worse. So I just wanted to share that with you. Other than that, that's pretty much all I have to say for this week. I'm just kind of semi-celebrating that I'm in 18s. I haven't been in the 18 since 1991. It's been a long time. And so it's good to see that again, even though, yes, I got the ugly skin. I hate it. But, hey, it's a part of me. It's a part of the process. So, until next time, people, I will see you, and take care of yourself. Bye.